He lifted the woman's legs and injected her with a muscle relaxant. After the muscles completely relaxed, he had her inhale anesthetic gas. In less than a second, the woman lost consciousness. Then the doctor supported her neck and used a dilator to pry open her mouth, inserting an oxygen tube. Once the woman was fully unconscious, the doctor taped her eyes shut. This was supposed to be a routine surgery. While performing the surgery, the doctor explained the process to the apprentice. Suddenly, the anesthesiologist quickly stood up. He noticed that the patient's blood pressure was rapidly dropping. Everyone became tense. After a brief moment of panic, the patient's blood pressure stabilized and the surgery proceeded smoothly. However, the woman suddenly remained unconscious, unresponsive to the doctor's calls. When the doctor checked her pupils, there was no reaction. The lead surgeon rushed over to examine her and immediately declared that she had suffered brain death. But the woman had no prior medical history, and the surgery had gone smoothly. How could she have suddenly experienced brain death without any clear reason? After consulting with several specialists, they speculated that the woman might have had an allergic reaction to the anesthesia, as such rare cases do occur in a few out of hundreds of thousands of anesthetic procedures. The hospital classified the situation as a rare event. However, Dr. Daisy insisted on investigating further because the patient was her close friend, Susan, and it was Daisy who had recommended her for the surgery. Daisy began reviewing the surgical records but found no abnormalities except for a suspicious test report. The hospital had conducted tissue tests on Susan, but such tests were unnecessary for a miscarriage procedure. This puzzled Daisy's husband, John, as well. What was even more perplexing was that the test report had no serial number, and the name of the doctor who conducted the test was missing. This strongly suggested that someone might be intentionally hiding something. However, John believed it was just a hospital oversight, as this sort of thing had happened before. He urged Daisy not to overthink it and reassured her that the hospital had already begun an investigation. But Daisy was certain that something wasn't right. She decided to go to the lab to find some answers. When she finally tracked down the on-duty doctor, he claimed that the test report had been printed out.